So the typical hip replacement is an elective surgery that patients can have when osteoarthritis, rheumatoid arthritis, osteomyelitis, or avascular necrosis begins to limit their function by limiting their range of motion. One thing that a surgeon wants to do is either an anterior lateral, or posterior approach, where they make an incision on that side, they go in, they cut the head of the femur off, hollow out the upper portion of the femur, and they would either use a cemented or a non-cemented implant. The difference being the cemented has a cement poured into the bone before the femur implant is put in, and that causes the patient to have an 8-week progression of touchdown weight bearing before they can become full weight bearing again. The non-cemented is the femur implant is just pounded into the opening in the femur, and it has openings for the bone to grow into to secure the implant into the bone. This is a 3-week progression. The thing about the cemented implants is it can become loose and therefore needs to be replaced often, whereas the non-cemented, it doesn't loosen because it's growing with the bone, but you can have an antalgic gait for 1 to 2 years with thigh pain from it. Things that need to be avoided are rotating and causing stress on the incision. So if it's an anterior approach, you don't want to have the patient put weight on it and rotate towards that incision. You also want to avoid any thermal agents, so no heat packs, no ultrasound diaphragm, anything like that. So it's better to use ice packs, ice massage to reduce the swelling, inflammation, anything like that in the incision. The patient should not have any range of motion greater than 90 degrees in hip flexion to avoid dislocating the new implant. And they should not be crossing their legs when they sleep or sit, so there's no adduction, no sitting with your legs crossed. If they do like to sleep on their side, they should be instructed to sleep with either a wedge or a pillow between the legs to keep that leg in neutral. And one of the exercises I had for the max protection phase would be ankle pumps to try and get that foot moving, keep the blood flowing through the leg to prevent formation of DVTs. So Angie, what I'm going to have you do is come over here on the mat with me.
All right.
And we're going to sit so that way your ankle is just hanging off the edge.
Oh, okay. Just go back a little bit.
Yeah,
Like
I
that.
want you to sit kind of leaning back a little so that way we keep your hip precaution. You're not
Okay.
going too far.
Oh, okay.
And what you're going to do is you're just going to flex your foot up like that, yep, and back down. And you would do that about 10 times, 2 sets. And this is something you can do at home. Maybe if you're lying on the couch or your bed watching TV, and it just, like I said, keeps that blood flowing.
Okay.
Then we can progress them into the moderate protection phase, and this is done once the patient is able to demonstrate quad control and reports a reduced pain and shows compliance with the precautions. So what we could have them do is light resistance to start strengthening the quads and hamstrings. So the exercise I chose for this is I'm going to have you stand up over here with the walker so we have some support, Andrew.
Okay. Just come.
Yep, right in here.
Okay.
And I'm going to put a TheraBand around your ankle here.
Okay.
So go ahead and step into that. And what you're going to do is you're just going to bring your leg forward and get a little bit of flexion to try and strengthen the flexors here. And again, you would do like 10 sets, 2 sets, 10 reps, or until fatigue starts to set in. And then once the physician
You can drink. Yeah, you're right ahead.
And then once the physician is able to discontinue the precautions, we can start moving into more functional exercises. So what we can have the patient do is start ambulating through the clinic or the hospital to simulate walking through malls, grocery stores, any type of public space. Walking in between nurse machines, out in the hall with other patients and faculty.